spoken.
So let's start with you on the next question, Representative Schumacher. A viewer from Fergus Falls wants to know what's likely to happen in this legislative session about legislation dealing with the mentally ill and funding the mentally services for the mentally ill. Take a run at that.
I don't know exactly. There haven't been, well, we don't have a system in Minnesota that really deals with mental health in a way that makes sense for people. You have law enforcement doing a lot of the initial crisis efforts. You have emergency rooms that are supposed to be dealing with physical health that are now dealing with mental health or holding people. You don't have the workforce necessary to do what we need to do in the state, and you have a lot of conflict on things like education level and who can do treatment and who can't do treatment. And so where we go from here is still really an open-ended question. When Governor Dayton had his Blue Ribbon Task Force on mental health just 2 years ago, the number one recommendation was to have another Blue Ribbon Task Force. And so it's hard to even get the stakeholders, the people who are experts in this, to agree on where we need to be going. And for the people, the lay people in the legislature who aren't the experts and working in this industry, we don't know where to exactly take this. And unfortunately, that's kind of tied our hands because we don't want to take an approach that's wrong. And so we're kind of left trying to figure out what we can do that isn't going to harm people. We have Results First that's been doing a lot of analysis on the programs we do have, and I'm glad to say that their findings are that we have programs that are getting very good value for what we're putting into them, really high returns on the investments there. And so I'm hopeful that we can see some more reform to the overall system, but we really need the stakeholders, the experts, the people who are doing this every day to really help us out this year so that we can move forward on this and really start to put together an actual healthcare, mental health system in our state.
Senator Kiffmeyer?
Well, as a registered nurse, I've dealt with mental health issues over the years. But one of the things that I think concerns me, though, in this time of, quote, social media, I almost think of it sometimes as asocial media, because I don't know that it brought us together. If anything, it seems to be tearing us apart. And I'd love to get back to not just Facebook, but face-to-face talking to each other. Because when you communicate, you have eye contact, you have body language. There are many things. You absolutely do not get that from the flat page of the internet. It's very limiting. And I think we need to do more of neighbor to neighbor, friend to friend, look out for each other, talk to them. In my neighborhood where I live, we just had a relatively young man who just passed away from cancer. The whole neighborhood knew about it. We took over food. That's a classic Minnesota thing. Anybody's hurting, just take them over food. So we did that, and I just think that some of this is a societal issue, that some of these mental health conditions, we found sometimes in Health and Human Services that loneliness brought people to the emergency room. And that when they allowed Regions Hospital and different ones to develop programs and untied their hands in some ways, they found that if they would just have specially trained people analyze kind of the patients they were having, and preemptively the clinic or the hospital would call them on a daily basis to check up on them and see how they were doing. And amazing, their visits to the emergency room greatly dropped. Because sometimes the hurt of an emotional loneliness can be as painful as some other physical injuries.
So I'm going to give you just about 30 seconds and do very quickly. And what do you think? Mental health, anything this session?
Yes, I think there are things that we can do with school-based mental health to be able to increase opportunities there. We don't have to swallow the ocean. We're not going to be able to do it all, but we can do way better. There's work that we can do with prison mental health. The stresses that are happening in our prison. Here's the point. There's a cost to mental health. There's no way to avoid that cost. It's going to come out either in bad prison environments, bad school environments, or we can invest in good mental health counseling to make those much more positive.